Good morning, everyone. It's very exciting to be here again the second day. Now, technology and data, these are integral part of our life. You cannot imagine any point of time without using mobile or something which is mandatory for your life need. We go to the Loya Park for walking. We pay for the breakfast there, for the tea by using UPI. So, particularly in health sector, it is more important now. Our legacy system, our traditional health system, health facility, where you go there, doctor observe you, and then you are taken care by their facility like nurses and systems, all are manually done. So a lot of documents and a lot of maneuvering here and there. So now, but with uh, increasing population and with increasing awareness, now this health system now faces a huge demand of more. We need more and better, and it should be uh, effective and affordable also. So this is very uh, unique combination of demands. So we need unique solution. So definitely technology and data-driven applications are now finding solution to improve healthcare system. And now with the advent of AI and emerging technologies, when you see the global market of only health information system is more than $500 billion, and whole health services, it is going to be 7 or 8 trillion dollar. So definitely it is getting into our daily life. Otherwise, the market cannot respond to new way of looking at improving health system. So, uh, from the government perspective, we are moving fast to take benefit of this market and the expertise and the information that lies with the private sector. So in UP, we have done a lot to integrate these things. So now we imagine healthcare system is technology embedded and data driven. So I will start with the public health system and how we are integrating. So look at this point of care test. So we have a huge team of ASA, Bahu, and ANM. They are spread over all villages, and now we have health and wellness center. They are catering to the health need at the population of 5,000. And we have more than 16 diagnostic tests available there, more than 60 drugs available there. So that is now becoming viable. The first point, contact with the person feeling something, they are having disease problem or something. So point of care tests we are providing there. CHO are there now, community health officer. So we create huge data per day, and we have the tablet with ANM and ASA. So they use application called eKavach, where we have enumerated family more than 21 crores. So whole population almost they are enumerated now, because they go door to door, and right now we are going to have this Sanchari Rog Abhiyan. So they travel every household to take symptoms of syndrome like influenza-like illness, vector-borne diseases. They also deal with TB, leprosy, filaria, and Kala-Azar. So we have almost data of all the person living in our UP. So now the interesting thing that these data, as uh, somebody was telling, that become platform. So on that, how to integrate different health services. So we have seen the success of COVID reporting portal, where this same data was seen to different people in their way. Suppose the decision maker was looking at the dashboard, so they can see where is the prevalence for the task force surveillance team. They could see these data in their form, where line listing and where is the problem is. So lab technician could see those data in different forms. So same data with the use of algorithm and application, that became useful for all. So definitely we need lot of improvement in this, and we got great success. I myself was given lab report of COVID test, I think more than 30-40 times on my mobile that were coming directly. So it was very useful. Without visiting facility, we could get information of our health. So e-Kavach, and second is the Unified Disease Surveillance Portal. So more than 16 diseases are notified there, and whole geographical on map we can get information about how many people are infected. So we send the team on a daily basis. We get information on my mobile, so we can do health action based on this. So this has become very useful now. So and then we have a mantra application where we take service delivery and outcome parameters, and they are recorded digitally for institutional deliveries. So there also those integration are giving a lot of outcomes, good outcomes. And telemedicine and teleradiology, every health and wellness center now they have teleconsultation facility. So 70,000 consultation per day we are having, and till now we have done more than 2.5 crore e-Sanjeevani consultations. So this is happening now. So we have to improve and scale up it to the tele management of these patients, and about therapy, how to manage therapy and ward management through tele. So this is a new thing which we can think of. Then we have a huge database of UP KSK, Uttar Pradesh ke Swasth Kendra. So every health facility, more than 40,000 health facility of UP are geo-tagged, and it is available on the map. Then care that take care of all the medical equipment. So we can see from one point that any medical equipment lying in any center, public health facility, it is working or not. So Manav Sampada, all the human resources deployed are mapped in Manav Sampada. So through API linkage, we can make use of these all data. So we have a challenge to develop useful HMIS application, so that right from beginning, from taking the preliminary parameters and integrating advices and taking appointments and all. So the Ayushman Bharat Digital Mission, this is the way the government thought of integrating all these stakeholder and health services on one platform. So there is a concept of Ava ID, that is for everyone who want to be integrated with this platform. So it's very easy process to get this. So UP is number one in generating we have generated more than 10 crore of IIT. Then we have HFR facility registry, then health personnel registry. So everyone get integrated into this, and you get a guarantee that the data moving on this platform will be totally secured. So this is the data security is done by maintaining a robust way of looking at security, and definitely it has developed by use of the private sector: data encryption, role-based access control, consent management, multi-factor authentication, audit trails and monitoring, compliance with data protection standards, federated data structures, architectures, and there is no central storage. So it is available at the health facility level, but when you need it, it can come to your mobile. So we are still working in many sectors where we have done MOU with IIT Kanpur to integrate, to use AI to have to work on legacy data. Suppose in TV, where a computer operator can suo moto go every village and scan it, and they generate data where we have set of people who may be probable having TB. So we can organize our resources to have their real TB testing. So that will be a long way to go. And if we go by data, so these technology embedded and the integration with private sector, I will show some data. Like in UP, we are using public Wi-Fi in the OPD registration area, and that has benefited more than 92 lakhs patients by a scan and share based quick registration, saving patients the burden of standing in OPD lines. The 1223 facilities are equipped with the scan and share. In HMIS, we are integrating AI-based cataract tracking application called eRosni, which will help track the 3.5 million visually impaired population. Currently, we have registered more than 17,563 facilities and 18,931 health professionals, and HMIS adoption in more than 1,832 facilities, with more than 2.3 lakhs record created in 35 microsites. And definitely the private sector like PATH is supporting in 18 microsite, and AESJ, Japiago in HWC, UNDP in UWIN portal. Now there is very thin demarcation between private and public. So we have trained around 180 private human resources for hand-holding in ABDM. Interesting thing about Reliance Healthcare is helping in Balrampur Hospital ICU. So there is a concept of tele ICU. So 24 hours you are getting the guidance from a specialist and benefiting 1,600 patients. And Apollo Medics is planning to support ICU in LBRN Lucknow. Total funds by private sector adoptions is more than 7.5. So we are working on creating the health care, quality health care, and universal coverage, so that it reaches to everyone. So we have many area for where we require a lot of public awareness and digital literacy and a skill. So you have to convince people and doctors and health facility to trust these technology, so that they confidently they can use these technologies. So there is a lot of challenge in awareness program. So in microsites, we are doing one-to-one training with private facilities. So they are getting they are facing lot of challenge there. They say this is how this is authentic and how my data will be secured and all. So there is a lot of challenge in awareness. So we have utilized IIC, PATH, WJCF, Piramal, and many other uh, uh, partners to indulge into effective awareness program. Uh, so we have developed health ATMs. More than 4,000 health ATMs are there. So there you don't need to go to the public health facility. So just go there. More than 300 testing can be done, and they are maneuvered by the PGI. They are specialist doctors sitting in the control room, and they take care of teleconsultation and everything. And we are using collaboration with telecom company to expand mobile network coverage, and lot many government initiative also augmenting these efforts. And our community health workers, these programs, they are becoming trained day by day. And we are using e-Sanjeevani application, which is friendly user interface and language support we are also giving. So also for the private sector to adopt, we are having digital health incentive scheme, where digitization, digitizing record, we give incentive to them. And more than 220 crores vaccinations have been administered through COVID, with around 39 crore within UP. And in Arogya Setu, more than 21 crore downloads were done across all the iOS and Android platforms. And approximately it was 2 crore in Uttar Pradesh till March. So this is happening now. This has become the part and parcel of people understanding, but still a miles to go. We need a lot. I interacted with many uh, people here who are working in different sector, like augmented reality. Somebody was working in capacity building based on data. So there's very interesting way of looking at the market. So I have requested the organizer to map these companies with the area they are working, and how they can help us in the big goals, like increasing access, improving more data-driven decision-making things to help us, public policy makers, so that we can utilize our resources well, and also how to collaborate with all the partners, and also these should also match, our efforts should match with the big global digital agenda. So it should match with the Digital India agenda. So it should match with the digital effort going in other departments, because it is a story of the people. So we have to deal with a story of the people. One of the component is health. So we have to see a big picture, and we are doing big effort in Uttar Pradesh, and we are hopeful to get very soon, maybe coming 2-3 years, to achieve universal health coverage, quality health coverage. We should cater to the needs of all, and strengthen our health system with all the emerging technologies. We can have virtual wards, using nanotechnology, guided the schedule of drugs delivery, and so many things here, research and development. So we can think of using genome mapping, very personalized drugs we can develop. There are so many scopes, because once you understand data, we have done lot in creating data. Now whole genome map is there. There are many HMIs already available all over the world. How to integrate all those information system? They are challenged to integrate different health facility. So inter and intra, both challenges are there. So we all put together, we should try to help the public authorities, and so the private integration and government private integration, both are required. And I am hopeful that in the future we are coming together. Thank you so much. Thank you.